Welcome back for another radclusive videos. Today, we are going to learn more about nuclear bone scans, including the uses, risks, and what to expect from the procedure, including the before and after. Before we proceed to this video, don't forget to click the like button, share to your friends, subscribe to Earlyseven YouTube channel, and click the bell icon for more radclusive videos. A nuclear bone scan is an imaging technique that uses radioactive substances to create three-dimensional images of the bones. Doctors use bone scans to diagnose and monitor bone diseases such as cancers, infections, and fractures. What is a nuclear bone scan? A nuclear bone scan is a type of nuclear medicine tool that uses trace amounts of radioactive substances, called radiotracers, to evaluate physical and chemical bone changes. A special camera, called a gamma camera, detects radiation emitted from the radiotracers. A computer creates 3D images from the gamma camera data. A bone scan uses an imaging technique called single-photon emission computed tomography, or SPECT. SPECT involves a radioactive substance and a special camera. Together, these tools produce 3D images of the organs and other internal structures. Unlike an X-ray, which shows what internal structures look like, SPECT shows how these structures work. For instance, a bone scan shows areas of increased bone activity, such as bone metabolism, a continuous process that forms new bone and breaks down existing bone. Doctors can also use bone scans to determine whether cancer has metastasized or spread from another area of the body, such as the lung or prostate gland. What are the uses of bone scan? Doctors can use this test to diagnose suspected bone diseases, identify the cause of unexplained bone pain, and monitor a person's response to treatment. A doctor may also order a bone scan for the following reasons. 1. Identify bone cancer. 2. Determine whether cancer from another part of the body has spread to the bones. 3. Locate hidden bone fractures that do not appear on X-rays. 4. Diagnose bone damage due to an infection. And 5. Monitor a person's response to treatment for a bone disease. A bone scan can also help detect the following conditions: benign or cancerous bone tumors, secondary or metastatic cancer to the bone, non-Hodgkin lymphoma, tumors in the soft tissue, osteomalacia or bone softening due to vitamin deficiency, osteomyelitis or bone infection, Paget's disease, a rare disorder that disrupts bone metabolism, and a vascular necrosis or loss of bone tissue due to restricted blood flow. What are the risks of nuclear bone scan? Many people may feel concerned or hesitant at the thought of having radioactive material inside their bodies. But a bone scan requires some amounts of radioactive material. The most commonly used radiotracer is the technetium-99m, and it has a short half-life of about 6 hours. This imaging procedure is non-invasive, but it does involve intravenous or IV injections of radioactive materials. There is a low risk of having an allergic reaction to radiotracers. A bone scan may be unsafe for people who are currently pregnant or breastfeeding. A doctor may recommend using baby formula and disposing of any breast milk until all radiotracers leave the body. Before the procedure, a doctor, nurse, or technologist will explain why they are performing the test and what to expect during and after the test. The procedure begins with an IV injection of the radiotracer. Once inside the bloodstream, the radiotracer will circulate throughout the body and adhere to the bones, which can take 2 to 4 hours. The technologist will lead a person to the scanning room, where they will position the person on the scanning table. The gamma camera will take a series of images of the body. The camera may rotate around the table, or a person may need to change positions on the table. The person must remain still while the camera is capturing images. The technologist will review the images. If the images are unclear or the technologist wants more information on a particular area, they can make some additional scans. Some radiotracer may remain in the body after the test. It will naturally decay and lose its radioactivity over time. Drinking plenty of water can help flush excess radiotracer from the body. That concludes our video for the nuclear bone scan. If you enjoy watching this video, don't forget to click the like button, share to your friends, and subscribe to Earlyseven YouTube channel for more radclusive videos.